So this is a great case from earlier this week, just reminding us that gender affirming care is really for everyone. This is a cisgender male, so a assigned male at birth, who many years ago developed what we would call idiopathic unilateral gynecomastia. So what that means is gynecomastia is usually found in cisgender males, and it's abnormal growth of the breast tissue. In most cases, it happens bilaterally, so on both sides, but in about 10% of cases, we see it like this unilateral. Typically, we do some blood tests and rule out causes of it. Gynecomastia can be caused by different medical conditions, hormonal conditions, or very commonly certain medications can cause it as well. And so in this patient, all of these causes were ruled out, so it's what we call idiopathic, meaning cause unknown. This patient had it for many years. He used a binder, and we're able to apply the same technique as we oftentimes use, keyhole top surgery technique. This is him just a few days afterwards, and you can see there is lovely symmetry between the two sides of the chest. We did nothing on the normal side, and we got rid of just the breast tissue through a little incision in the nipple. Typically, a surgery like this takes me, when we're doing both sides, it takes me 2 to 3 hours. In this situation, obviously it took me half of that time. Patient goes to sleep, we just use that one little incision, and it tends to heal really well, with pretty much no scar in the long term in most patients, because that scar is hidden nicely in the patient's areola. We do it, of course, for trans folks, for cis folks, depending on what their needs are. And there can be a lot of confusion among the trans community who is a good candidate for this surgery and who's not. So what you have to remember, with keyhole surgery, we're not doing anything to get rid of extra skin. So this patient, as you can see, didn't have much extra skin because he's not got much of a fold underneath the breast that had enlarged. So therefore, we're relying on the body to shrink back down that extra skin. And we're going to keep the patient in the wrap for probably 4 to 6 weeks after surgery, minimize a lot of activity there in order to avoid fluid collections. Tends to be not a very painful surgery. It's an excellent technique for top surgery, but only if the patient meets criteria. I'm pretty conservative in my patients, meaning that I'll only offer it if I believe that skin is going to shrink down, because it can be pretty disastrous if you do it on somebody with too much skin and they're left with loose, saggy skin on the chest, which looks strange, it looks surgerized, and usually that means you have to go ahead and do a full second surgery, do top surgery, so double incision top surgery with a free nipple graft. So talk to your own surgeon about it. If it's something you really want, you can get multiple opinions, you can shop around, but a lot of the time in cisgender folks who have this condition of gynecomastia, it works very well because the anatomy is set up very well for it in the first place. And I just thought this was a cool case reminding us that gender affirmation surgery is for everyone.